Hello, ViQuest family. My name is Danielle Cunningham, and today's training we will be discussing the TBS and CPST services and interventions. Now, this is going to be a specific training for our nurses, our nurse practitioners, and our development team, where we're going to discuss and learn about case management services so that we can provide appropriate referrals to our clients and know what type of services the client can receive. There's also going to be a handout, quiz, and sign off that is going to go along with this training. So, what are the objectives of this training? So, we're going to be discussing medical necessity, the TBS and CPST services and interventions, Ohio regulations, the purpose of services, allowable services, and the basic competencies. So first discussing medical necessity, so the golden thread of necessity. So medical necessity is a payment and clinical concept. Conditions of medical necessity are met if all of the following apply. So 1, it meets generally accepted standards of medical practice. So before TBS services can be provided, every client needs to have consents and assessments and an evaluation completed with a primary mental health diagnosis. So 2, clinically appropriate in its type, frequency, extent, and duration and delivery settings. Appropriate to the adverse health conditions for which it is provided and is expected to produce the desired outcome. It is the lowest cost alternative that effectively addresses and treats the medical problem. Now, in the beginning of sessions with your clients, you should be building rapport, having some discussions about different agreements that needs to be had of how often, how long, and where you will be providing these services. We also want to make sure that in these conversations that we're being mindful of our clients' barriers and conditions and concerns that the client may have. So 5, it provides unique, essential, and appropriate information if it is used for diagnostic purposes. So not provided primarily for the economic benefits of the provider, nor for the convenience of the provider or anyone else other than the recipient. So we are not just providing these services because we can get our required productivity expectations. No, we want to ensure that if we're going to be providing a service to our client, that it is medically necessary to provide that service. So some questions you want to keep in the back of your mind when thinking about medical necessity is, why am I referring my client to this service? Okay, so what will my client gain or benefit by engaging in this service? What is the mental health reason for this referral? What is the link between the client's identified issues and concerns related to their mental health? Is what we are working on, can this tie back to the client's medical ITP? And does the client's symptoms prove to be a barrier for them doing this service independently? Now, there's going to be a more detailed training on medical necessity as well. So now discussing basic competencies. So this is about understanding of the client's mental illness, understanding of the community behavioral health system, social service system, and the criminal justice system and other healthcare systems. So knowledge of psychiatric and substance use disorder symptoms and their impact on functioning and behavior. The ability to therapeutically engage either with a person with mental illness or a person in substance use disorder treatment and recovery, knowledge of crisis response procedures, and practice of de-escalation techniques, and an understanding of how the individual's own behavior can impact the behavior of others. Now, discussing the two different specialists that can provide these services also to the client. So that is a qualified mental health specialist, QMHS, and a qualified behavioral health specialist, QBHS. Now, a qualified behavioral health specialist means a person who has received training for or education in either mental health or substance use disorder competencies. and who has demonstrated prior to or within 90 days of hire the minimum competencies in basic mental health or substance use disorder and recovery skills listed in this rule. Now, understand with ODMHS, they certify a mental health and addiction services agency, whereas VPBS and here at ViaQuest, we focus on mental health. We can provide our clients with substance use services and linkages, and a client can have both a qualified mental health specialist and also a qualified behavioral health specialist. Now, discussing here what TBS and CPST is the Ohio Administrative Code. So, OHC 5122-29-17 is the Community Psychiatric Supportive Treatment, and then the Ohio Revised Code ORC 5160-27-08 is the Mental Health Therapeutic Behavioral Services for TBS. Now, the Ohio regulations VPBS has to follow as a community mental health agency. So, discussing TBS and CPST services. So, these provide an array of services delivered by community-based, mobile individuals or multidisciplinary teams of professionals and trained others. So services address the individualized mental health needs of the client. They are directed towards adults, children, adolescents, and families, and will vary with respect to hours, type, and intensity of services, depending on the changing needs of the client. So, CPST, the Community Psychiatric Support Treatment. So, the method of CPST service delivery shall consist of 1. Service delivery to the client and or any other individual who will assist in the client's mental health treatment. So, this is services delivery typically by phone and or by video conferencing. Service delivery may be to individuals or groups. And then 2, CPST services are not site specific. However, they must be provided in locations that meets the needs of the person being served. Now, TBS are therapeutic behavioral services. Now, TBS must be delivered to a client or group as a face-to-face intervention to the client, family, caregiver, and or other collateral supports. So now we're going to discuss the purpose of services. So what is the purpose of TBS services? So the purpose and intent of case management services is to provide specific, measurable, and individualized services to each person served. Case management services should be focused on the client's ability to succeed in the community, to identify and access needed services, and to show improvement in school, work, and family, and integration and contributions within the community. So for the purpose of Medicaid reimbursement, services are goal-directed supports and solution-focused interventions. So what are solution-focused interventions? These are solutions building rather than problem solving. So instead of focusing on the present problem and past causes, solution-focused interventions focus on how the client's current circumstances and future hopes. So an example there, if a client is struggling with excruciating shyness, but typically has trouble speaking to his or her coworker, a solution-focused intervention would target the client's interactions at work as an exception to the client's usual shyness. Now, these are also activities included must be intended to achieve the identified goals or objectives as set forth in the individual's treatment plan. Now, everything evolves around the client's treatment plan. The treatment plan is the most important component of treatment, and it justifies our billing for Medicaid. The treatment plan being the most important component because it gives guidance on what exactly is our focus in treatment. What goals and objectives are we currently working on with our client? What needs do we need to work on with our clients? Now, just some documentation reminders. For every client receiving TBS, the assessment and/or psychiatric evaluation will include recommendations on when to start services. Staff would oversee their caseload to identify when assessments and evals are needed and meeting requirements on when treatment plans are to be reviewed. Now, since March of 2020, we now have forever consents, but the release of information is still a document that needs to be completed annually. So just ensure that we are completing the client's release of information and that our clients have consents. The psych team's treatment plans are due annually, and the TBS treatment plans are due every 6 months. Now, going into our 10 activities for interventions of a TBS and CPST caseworker, this is going to be the handout that you will have. So this handout just discusses the 10 activities of a caseworker. So in this training, you will find more examples and handouts that TBS can utilize with their clients in sessions, and always relating it back to the client's mental health and their treatment plan to ensure medical necessity. So our first intervention here is ongoing assessment of needs. Now this is overall needs are assessed. This can include assessing the need for housing, vocational assistance, income support, social support, transportation, and etc. Now some activities that TBS can do with the client is our functional life domains assessment. Now there is a handout where you can actually walk through and explain what the life domains is for your client, and you'll also have an assessment if you need to jot some things down as you are doing this with a client. Getting to know you UNO, our self-care assessment, and our emotional exploration scale. The second intervention is achieving independence. Now, this is assisting in achieving personal independence and managing basic needs as identified by the client or guardian within the context of the client's mental health treatment needs. Now, we are always working to help our clients achieve independence and be able to do a lot of things independently. Now, some of those activities is a hygiene chart. Now, we don't know our client's upbringing. We don't know if they know how to complete their hygiene. And so sometimes we have to kind of take a step back. So having or developing a hygiene chart for a client will help them identify what areas do they need to target. And then they'll just have a list that they can refer back to and remembering on what they need to complete in regards to their hygiene. Now, the goal exploration. Now, we're always working towards our clients' goals and objectives, so that goal exploration handout will be very helpful in helping your client independently figure out what goals they have for themselves. And then our social stories. If your client needs to achieve that independence and they learn better with watching a social story or reading a social story, that is also a helpful intervention to help with achieving independence. Our third intervention is skill building. Now, this is facilitating the further development of daily living skills as identified by the client and guardian within the context of the client's mental health treatment needs. So again, these are going to be more examples and handouts that TBS can utilize with their clients in sessions, and just remembering to relate it back to their mental health and in their treatment plan. So for some example, handouts here is our progressive muscle relaxation, our mindful cards, that task analysis, and our clients' habit plans, so helping them build new healthy habits. 4 is coordinating. So the coordination of the individual's treatment plan, including participating in and utilizing strength-based treatments and planning, which may include assisting the individual and family members or other collaterals with identifying strengths and needs. Assistance with assessing natural supports in the community, linkages to the formal and community services and symptoms, restoration of social skills, and then establish support networks, increase community awareness, develop coping strategies, and promote effective functioning in the individual's social environments, including home, work, and school. So coordination of the individual's treatment plan also includes our social support worksheets, so helping our clients being able to identify their support systems, communication skills, so being a reflective and active listener, our SNAP recovery worksheets, and our strength chain activity. Now, with our SNAP recovery worksheets, every position will do a SNAP with the client throughout treatment, and this can be utilized in developing our client's treatment plan. So being able to identify a strength for that client, an ability for that client, a need for that client, and a preference to treatment for that client. So 5 is symptom monitoring. So symptom monitoring allows the staff to engage the client and document the client's mental health needs. Now, some activities here is our anger diary and our anger stop signs. So being able to identify when our client is beginning upset and to kind of help with some de-escalation there. Our daily mood chart. If a client is having some issues being able to identify their mood, our daily mood chart can be helpful. And where do I feel, along with our feelings chart. So being able to monitor our client's symptoms. So coordination and or assistance in crisis management and stabilization. So this is not crisis intervention. Rather, it is the activities which provide wraparound support for a client in a crisis, immediately following a crisis, and or to prevent an immediate crisis from occurring. Now, some handouts here is our safety plan. Now, safety plans should be completed within SmartCare. We do have paper versions available, but we are no longer scanning those into our client's chart, and they should be completed electronically within SmartCare. Now, all clients with any suicidal ideations, HI, any self-harm should have safety plans completed. Best case is for all of our clients to have safety plans, but just ensure that we are completing those within SmartCare. Some additional handouts here is our distress tolerance, countering negative thoughts, and our Dear Man. Next is going to be advocacy and outreach. So this allows the staff to advocate for the client in the community when the client is unable to advocate for themselves due to symptoms of their mental illness. It includes the provision of outreach services by the case manager to ensure the client's rights are protected. Advocacy can include, but is not limited to, case manager attending ISP and BSP meetings in efforts to support the client, meeting with other agencies, families, and etc. Advocacy is supportive in not only simply completing a task for the client. Want to teach the client how to become self-advocates, which can lead to their independence. Activities to assist with advocacy can include our I statements, problem solving, and our emotional first aid. Our next intervention is going to be education and training. Now, this is directed towards clients and, when appropriate, their family. It is specific to the assessed client needs, abilities, and willingness to learn. Interventions can include education about the client's mental illness, medications, and side effects. So this is about education, education, education. We do provide you with some education, some mental health education websites, but I think it's very important that we should be educating our clients on their mental health diagnosis. So next is going to be our mental health interventions. So mental health interventions that address symptoms, behaviors, thought processes, and etc. that assist an individual in eliminating barriers to seeking or maintaining education. So some activities can include our cognitive behavioral therapy, our CBT worksheets, ACT, and the cycle of anxiety. And then our last intervention is empowerment. So these are activities that increase the client's capacity to positively impact their environment. These are activities that empower the clients in those educational activities that result in the client's ability to positively impact the environment in which they live in. Now, empowerment can tie to all of the other previous interventions and importance of working on self-confidence and empowering our clients. We should always be working on empowering our clients to reach their highest potential. Now we're going to discuss how to refer a client to TBS services. Now, the referral and intake process for internal referrals are just notifications, but for facility referrals, there's a different referral form used, which development will be trained on separately. So just some reminders here when referring a client to services. We need to complete the referral and intake form, providing details of why this client would be a good candidate for this service. Now, some questions that you want to keep in the back of your mind when thinking of referring a client to TBS services is what is the reason, symptoms, situations that will prompt a referral, and what benefit would the client gain by engaging in TBS services. So to continue, a mental health diagnosis is required for a client to receive TBS services. So some exclusions are IDD, dementia, Alzheimer's, and substance use disorders. Just a reminder that NPs will complete an evaluation of the client's mental health diagnosis, and some common diagnoses are MDD, major depressive disorder, GAD, generalized anxiety disorder, schizophrenia, and bipolar disorder. So now discussing the purpose of services when referring a client to TBS services. While the psych team may not have the time to practice TBS skills with the client, this is where TBS comes to support the client in this area. So TBS may have time to practice skills that the psych team may not be able to do. So think of this as kind of backing each other up. Okay, TBS and the psych team work together to provide services to the client. They can come together to discuss the client's coping skills and treatment focus, and TBS will implement with the support of the psych team. So the psych team's role is medical in nature, but services provided always relate back to the client's mental health. So interactions are limited to interventions such as checking and monitoring client vital signs, handling emergencies and crisis situations, acting as a liaison between clinical staff and the client, educating on administration of medications and treatments, and providing follow-up testing when needed, and etc. So some clients may have more needs or higher level of needs, and in these cases, these are clients that will benefit from receiving TBS services. So when a nurse is completing the SNAP assessment as a part of creating a new medical ITP, they may identify a variety of client needs, both medical and non-medical. So some of these needs a nurse may assist the client to meet, while others are beyond their scope of practice, and as a TBS may be better equipped or trained to support the client in that area. So this is where coordination with TBS is going to be very important. So there can be a variety of needs. The client may need to increase their social support. They may need to gain more knowledge and understanding about their mental health diagnosis, about the specific medications they take, the symptoms and behavior that relates to that diagnosis. The client may also need some assistance with helping to stop smoking, maybe to increase their effective communication skills, improving their sleep. So these are all needs that the client potentially can need help with working on. So just remembering that all positions will complete the SNAP assessment throughout treatment, and this can be utilized in developing your treatment plan for your client. Case management, NP, and nurses work together to identify a plan of care for patients by assessing needs, planning and implementing care, and evaluating outcomes. The NP and nurse can assist the TBS provider with identifying appropriate services and facilities throughout the continuum of services, while ensuring the available resources are being used in a time and cost-effective manner to obtain optimum value for both the client and provider. And now that is going to wrap up our training on our TBS and CPST interventions. Like I mentioned in the beginning of this training, there will be a quiz and handout available for you to complete after this training.